So when we start operating the clinic, we only have 6 health workers and about 20 patient visits a day. So we are very small and we have our own like medical records and data collection system and very simple. But gradually service been expanding and we have more and more health workers and more sector. Not only general health, we have vaccination, family planning, malaria. So how to track all this information become challenging for us.
This project came about when one of the fellows at Equity Initiative, Titar, shared with me her challenges that she faces in the Maytao clinic, where the staff was relying a lot on pen and paper.
The issue is we never have the group or the team or a person who will always focus on this issue and work for a long time on this HIS.
Traditionally, it takes about $20 to $200 million USD to build, design, install, and train staff in a hospital in Thailand to adopt electronic health records. This is absolutely out of reach for a free clinic like Maytao. So we had to be more creative in how we thought about this problem. We started a registration system that enabled every single patient to have a unique ID card that they can scan and retrieve their medical history. We also built systems that allowed doctors to enter in patient details, clinical records, and various observations that can help with continuity of care in the long run for these patients. Previously, they were operating as separate units, all with the logbooks and pen and paper. Now they're all integrated, right, with laboratory, pharmacy, and outpatient departments, all relying on a single source of truth when it comes to patient medical history. So this has a big impact on how the clinic is run and the kind of care that it can deliver for its patients in the longer run.
Every time we visit, we are learning more and we are creating and prototyping and testing and building on top of, refining. And I think the iterative process also allows room for existing processes at the clinic, the non-digitized processes, to also improve. And I think that adds a lot of value and also a lot of ownership, so that when we leave, it's not a foreign object to be handled with care, but actually it's part of the way that things work, and it's something that can morph and change as the clinic grows or changes too.
Actually, our staff or people here do not have much opportunity to learn advanced technology, and sometimes it is challenging for them to see the whole picture. So whenever we learn new system or new skill, we have to review the organization structure and the role and responsibility for each area, because it is directly linked to the workflow, but they are all working as a team and to make sure that everybody understands to be patient and to support each other.
It's been really rewarding to see that all the edge cases that I explained, or I said, oh, be careful when you do this, you have to keep this in mind. I can see that being communicated to everyone else.
Actually, the community sustainability, the community empowerment is very important. That's why recruitment of health workers or train the local people is very important step, because when you train the local people, they know the context and they can give more inputs to how to sustain this program.
So I hope that the work we do here in helping the staff do their work more easily and at a higher quality and serve more patients will translate into easier access to healthcare and consequently better outcomes.
I feel so happy that I see people are really enjoy to be in this journey, and they also want to see the change.
To improve healthcare, everybody come together and share their expertise or knowledge. You cannot isolate yourself in geographically or ethnically, but you need to see the value of how other people contribute while you are working on the same issue.